and not to be subjected to unnecessary and embarrassing interrogation in their genuine attempt to save lives. And it goes on and on, but these are the very important one. It has obligations for the police. It also talks about the hospital, and I'll just quickly go there. Any hospital that receives a person with gunshot wounds must do the following: report to the nearest police station with 2 hours of commencement of treatment, notify the family members, or really exactly within 24 hours of becoming aware of the victim's identity. And this, and another reason why some Nigerians, who I know that we really love to help, sometimes you see a victim of some sort, whether gunshot or not, and you say they huddle in trying to explain. You go explain tire is what they will say, in trying to explain why how I got to meet this person is too much, let me let that go. With this act that has been since 2017, yet we still see what has been going on. You were talking earlier about these emergency services. Do you think it would indeed get to every Nigerian patient? So should we hypothetically start seeing these ambulances as key performance indicators to it?
I think, first of all, you talked about the issue of potential volunteers or helpers,
right,
okay, not wanting to get involved and stuff, and that's because the system doesn't work, and the average person doesn't trust the system. Okay, that's why I keep going back to this thing of having serious people that will actually lead, or serious people within our MDAs. Okay, now the key thing is this. Okay, what do you need in terms of an emergency medical service? Okay, there are a couple of things that you actually need. Okay,
right.
Number one, you need organization. Okay, number two, you need coordination. Number three, you need the human resource. And number four, you need some sort of categorization of the facilities that are actually going to be dealing with this. Now, when you talk about the emergency medical services, let's actually break it down. You're talking about the kind of service to people who have medical conditions that are serious to life-threatening. Okay, and they're happening in the somewhere in the community, and then you actually have to look after them from where this acute or emergency medical condition is happening to them till when you get to the facility. So you have what we call pre-hospital care. Okay, and then you now have the hospital care where you look at the emergency services within the facilities. So let's start from organization. How do you organize an emergency medical service? Okay, so you're going to look at, for example, all the way from what, for example, let's take Federal Capital Territory.
Right.
Because that's what they are trying to do.
This year,
you want to do the pilot in the Federal Capital Territory, see
NEMSAS.
It works, and actually move it out. So what do you need? You need to make sure that, for example, that the FCT administration, that they are really, you are poised and really serious about actually creating an emergency medical services, first of all, in the place. Okay, so you need the Secretary of Health in the FCTA to make sure that they are standing on this and actually making sure that things are happening. Okay. You need to make sure that all the hospitals have the capacity. You have hospitals that have the capacity. I mean, that's really important, because if you look at, for example, this act that you talked about, it talks about any patient with gunshot injury that goes to any hospital. Or whatever. No, I have a problem with that. Okay, it has to be a hospital that has the capacity and the capability to manage such a patient. Okay, there's what they call the golden hour rule. Okay, if you have a patient or an individual who is in big trouble and has a life-threatening condition, there's a golden hour rule. If you're not moving that patient, first of all, if you don't have within the pre-hospital care that capacity to actually start doing something for the patient from where you're actually finding the patient, and en route to the facility where you're getting the patient, and also getting to a facility that has the capacity, that individual is already in big trouble. Okay, so you need so like I said, organization. So this is need to be organized, but you need to make sure that you actually have facilities that actually have the wherewithal, the materials,
exactly,
all the key things. So that's organization. Coordination. We need a multi-purpose, multifunctional call center. Okay, when you make that 112, for example, okay, they can actually listen to you, coordinate, find where the nearest ambulance is. Even if they cannot get an ambulance, they can tell you that, hey, go to my Tama General Hospital. We have beds, free beds in because one of the things you find out is that a patient is in trouble. People who want to help, volunteers, they carry the patient to a particular hospital.
There's no bed
space. Okay, then they run to the next one. There's no bed space. They run to the next one. What if with technology, simple, we have phones? What if there's a call center where you just call and say, hey, we are in trouble? I say, okay, there's no ambulance close to you. Do you guys have a car? Yes. Where can we go to? Okay, move to this hospital, because they know. They argue every morning, everybody constantly, they're getting feedback and information, data of here. This hospital has bed space, or that hospital has bed space. So coordination, even up to the point where if you, for example, a patient comes to to a particular, I'm from Federal Medical Center, come to Federal Medical Center, there's no bed space. They'll say, oh, this patient is in big trouble. Oh, let's do something. Okay, now let's refer this patient from Federal Medical Center to a national hospital. You should be able from that to know that, be able to call the 112 and say, hey, I want to refer this patient to a national hospital. Is there space there? Can you connect me with the people in national hospital? Let me speak to them. Oh, I have a 36-year-old lady here who has just been stabbed and stuff like that. Oh, we don't have space and everything. Can we transfer the patient? Oh, yeah, we have space. Please transfer the patient. Coordination.
Exactly.
Having that sort of call center that is robust in terms of actually being able to be that middleman that actually coordinates things and stuff like that. Number 3, human capacity. When you look at some of the articles that we've read, for example, you see that they did a training of 66 people. Oh, 66 people are going to be involved. Oh, they did training of 85 people. Can we please stop playing to the gallery? Do you know that the University of Benin Teaching Hospital in the south part of Nigeria, they're actually training paramedics? I'm sure for the last 4 years they've been graduating paramedics. So you already have a pool already to actually use. I'm sure if you go and look at these paramedics, some of them don't even have jobs. Some of them are looking for jobs. Can we please be serious? Okay? And then finally, categorization. That is very, very important. Despite the fact that you have secondary and tertiary,
okay, right.
We should know in Abuja, for example, by the time you have very trained paramedics, they are called to the scene of an accident, or someone is stabbed, someone is shot and stuff like that. They assess the patient.